What we looked at is we talked with clinicians who had been involved in the care of a patient who received substandard care because they had been in a state that had a post-Dobbs restrictive law, an abortion ban or a restriction really early in pregnancy. And when we talked to these clinicians, some of whom were in those states and some were in states where abortion remains broadly legal, who received these patients, we found that there was enormous gaps in terms of what the clinicians wanted to be able to do, what they were trained to be able to do, and then what they were able to do under these restrictive laws. And that led to an increase in known and preventable health harms for these patients. So what we found is really three different categories of patients who these bans really negatively impacted. In the first category, these would be people who had an existing condition that was made significantly worse by their pregnancy. So, for example, somebody who already had a serious heart condition, by continuing the pregnancy, which puts a greater load on the heart, it was known that there would be a point at which this would become really serious and likely fatal. However, in the current moment, this patient's heart condition was managed. And so they weren't technically in a life-threatening situation. And these were the first category of patients that clinicians said they were unable to care for under these post-Dobbs restrictive laws. In the second category of patients that clinicians told us about, these were patients where pregnancy itself was the health condition that could cause them harm. So these were patients where the pregnancy had a complication. So, for example, preeclampsia, for which the only treatment is to end the pregnancy, or other conditions that have been featured in a lot of news articles, for example, such as PPROM. This is where there's a rupture of membranes too early to deliver a live baby. And if the pregnancy isn't ended promptly, this can lead to very quickly a very serious infection that can lead to sepsis and then even death. So, in these conditions, clinicians were engaging with a patient who had, say, PPROM or preeclampsia, which leads to very high blood pressure and then death. Um, and they knew that this would become life-threatening, but in the exact moment, it wasn't. And again, restrictive post-Dobbs laws prevented them from being able to offer the treatment that they knew would prevent these health harms to their patients. In the last category of cases we found, these were instances where there was inevitable fetal or infant death. Based on screening and testing, it was clear that this fetus was going to die before birth or immediately after. And in these cases, too, the clinicians were prevented from being able to intervene to end the pregnancy. These were cases where the fetus, for example, currently had a heartbeat, and that was considered evidence that it was still quote unquote healthy. However, all other evidence showed that it wouldn't continue to be able to survive either during the pregnancy or immediately after. And these patients also were required to continue their pregnancy because the fetus was not giving evidence of immediate emergency, and the pregnant person also was not technically in an immediate emergency.